everyone to the Autism Now What podcast. Today I'm speaking to Tara Fortier from the United States of America. Tara is a veteran BCBA. She has been working in the field of applied behavior analysis since 1998. She was lucky enough to be introduced to ABA at the Kennedy Krieger Institute in Baltimore, Maryland, starting as a direct care staff and working her way up to supervising her own clients with the oversight of some of the most prestigious behavior analysts in the field at the time. After 3 years of learning from the best and knowing that she wanted to pursue ABA as a profession, she moved to Tampa, Florida, to obtain her Master's of Arts degree in Applied Behavior Analysis from the University of South Florida. Again, having the opportunity to work with many well-respected behavior analysts. Tara says, one could say that I have very good ABA pedigree. Now, since receiving her BCBA certification in 2003, she has had the opportunity to work in a wide range of settings, including homes, clinics, residential settings, and schools. She lives in Rhode Island with her husband and her 11-year-old son and 10-year-old daughter. Tara, it is so wonderful to be speaking to you today.
Thank you so much. It's great to be here, Alana.
Now, today we're going to be speaking about that old diagnosis of Asperger's, and I'm just going to jump in and ask you my first question. Many parents tell me that the doctor said their child has that old diagnosis of Asperger's. Can you tell us more about what does this mean?
So what happened over the past few years is that what used to be Asperger's and what used to be autism, and there was a couple other diagnoses in that category, was changed to what we call autism spectrum disorder. And so what ASD, or autism spectrum disorder, is it encompasses all of those things, or those previous diagnoses that used to be a little more specific. What I think people have realized is that there's still a lot of those same sort of things that we would see in somebody who had an autism diagnosis versus an Asperger's diagnosis, of those kind of issues with social communication and those repetitive and restrictive behaviors. And so what that means is that those are the things that we're going to look for and that are going to kind of be on that spectrum, versus these more like individual specific diagnoses that that existed before. Typically what we thought of with Asperger's previously was that those are the individuals that they have a great language skills. They have great, they're able to learn very effectively. They generally don't have any issues with cognition or anything like that, but they struggle socially. And so these are the individuals that might be a little awkward, or they might have like a really like heightened interest in one thing that might be perceived as odd or kind of strange, or they get stuck on things and they only want to talk about certain things. And so those individuals are now at this point considered on the autism spectrum. But we also, knowing those individuals, know that they have great language skills and they have a lot of, other things that are strengths for them. So what used to be its own diagnosis is kind of more of like a wider spectrum of those like social concerns and those repetitive restrictive sort of behaviors.
That was a very good explanation. I think that puts a lot of things in perspective and helps us understand when we talk about the higher functioning autism. Now, children with Asperger's or high functioning autism can struggle with flexibility. How can we address this?
So that is often the case. And I think, oftentimes somebody that, may have had a previous just autism diagnosis where they have some language issues, or they have, some difficulty with communication that somebody with Asperger's does not, also have those flexibility issues. They just look a little bit different just because they're two different people. But so with flexibility, I think, sometimes what happens is that we change our environment to make sure that that inflexibility doesn't result in major problems or major challenging behaviors. And so I think on a proactive side, one of the things that's important to think about is not always kind of rearranging the environment to handle that inflexibility. So, kind of building inflexibility into that person's world kind of intermittently and randomly so that they don't get so stuck on those sorts of things. I've worked with children in the past where they always take a certain route in the car to go to a certain location to somewhere they go frequently, and they always drive the same way. And when like there's construction or there's an issue and they can't go that way, then that becomes a problem. And so one of the things that if we know that's an issue is, if there's a new routine established or there's a new place you have to go frequently, is don't always go the same way. Kind of build in that flexibility proactively and from the beginning so that that individual doesn't get so used to this is the only way I can do it. So that's just one example, but just kind of being really mindful of, building in change so that you're not always doing things the same way. If there's something that's already established as like a routine or where that individual is going to be really inflexible, then what you have to do is start with like just really small changes of that routine. Okay, maybe we're just going to do something a little bit different this time, and we want to make sure we're building in a lot of reinforcement for them being able to handle those small tiny changes, and then you would build up from there. So maybe then, if it's the driving in the car example, maybe you drive the entire route except the very end, and you maybe go around the block one extra time, and then you reinforce that person for, hey, you did a great job, you handled that. We did something a little bit different, but we still got there and everything's okay. And making sure you're reinforcing them being able to handle those small changes in a successful way. And then you would want to increase from there.
What I'm hearing from you is that we need to tackle it with small steps.
Yes.
And I'm so glad we're talking about this today. And I'm so excited to be chatting to you about how ABA can help that child with the Asperger's, because often parents will say that they kind of tiptoe around the kids, they're walking on eggshells, and as parents, we tend to set everything up for them to be successful. So maybe the take-home message for parents is just change one small thing and you can build from there, because ultimately we do want the children to learn flexibility, which is actually an executive functioning skill, and is going to be something that they need to also be successful in a classroom setting. Now, can these individuals actually learn to broaden their interest, as they tend to have very specific topics that they become obsessive over? They can't move off that specific topic in a conversation. Can we teach them to move off their topic of interest?
Yes, absolutely. You can definitely teach that skill. I think one of the things you have to keep in mind, especially when initially teaching it, is that may not be that interesting to them at the moment. So you may have to, really use a lot of reinforcement for, I know you don't want to talk about this, or I know you don't want to listen to me talk about this other thing, but this is what we're going to do. And then, we're going to reinforce that. And, and teaching them those kind of underlying conversation skills. And if somebody makes a comment about something, it's nice to ask a follow-up question, because it makes them feel good and it makes them feel like that you're interested in what they're saying. Maybe initially they're not interested in what you're saying, but it's one of those skills that we pick up on naturally in our environment when we're learning to interact with people. And those are skills that are more of a struggle for somebody on the autism spectrum. And so we actually have to teach them explicitly. And it feels a little forced and it feels a little weird, but at the same time, they have to be able to do those things, and they have to learn it in a more specific way than somebody without an ASD diagnosis would learn it.
I think the important thing to remember is that they can actually learn the skill to move off topic. And that's the most important point. Now, some individuals with Asperger's will struggle with attention. How can we work on improving their attention span?
We would work on it in a very similar way that we would work on it with a child that maybe doesn't have those, or has more language deficits or has more communication issues, where we would just start with really small steps and, getting them to be able to pay attention and successfully complete something small and easy. That's, I think, one of the things that we forget, and we need to keep in mind is that, when you're initially teaching a skill, and you want that individual to get some reinforcement for doing it, start where they're going to be successful. So, if you want them to pay attention to a 20-minute lesson by the teacher and they can't do it, just go ahead and watch a lesson and see how long they actually can pay attention. Maybe it's only 30 seconds and then they get off task. And so that's where I'm going to start is, okay, great. You pay attention for 30 seconds and then we're going to, have some sort of reinforcement or reward built in, and then we're going to take a little break and then we're going to come back and do it again. And so, starting with where they can achieve that success and get some reinforcement is really, really important. We don't want to set them up for failure where we're expecting them to do something that's way outside of what they're currently able to do. So there's definitely ways to teach an individual with Asperger's to increase their attention. It just has to be done gradually and with keeping them successful in mind.
It's been wonderful for me to learn the principles of applied behavior analysis. And with ABA, we use what motivates each individual child to teach them those skills that they're missing. And I've learned, even with my own children, that really identifying what they love and dangling that carrot will actually help them to make those changes in the areas where they struggle. Now, my last question for today is going to be, parents raising children with Asperger's will often say that their child has so much anxiety. How can we teach emotional coping skills? Because sometimes that anxiety, and I've experienced it with my own son, can be absolutely debilitating.
Yes, absolutely. I think, it's important to look at what's causing that anxiety too, and sometimes it comes from those really rigid, inflexible ways of thinking and ways of interacting with other people. And when you change that, that's really stressful for them. And it creates that anxiety. And so, one of the ways that, we work on emotional coping and that sort of thing is kind of breaking down for that person, what's a big problem and what's a little problem. Sometimes what happens is it's a little problem to you or we would perceive it that way, but to them it feels like a huge problem, and they have this huge reaction and they get really, really stressed out over something that you or I wouldn't think is a big deal. And so what we start with is teaching okay, here's why this is not that big of a deal. Here's why this is a small problem, because, you can easily fix it. Nobody got hurt. There's lots of pieces that might go into that. And then teaching them, here's the kind of reaction you can have to those things. And that's going to also tie in with that whole flexibility thing we talked about, of reinforcing them for being a little bit more flexible, reinforcing them and rewarding them for being able to handle those little changes and not maybe having a little bit less of a reaction to a small problem. So I think the general theme of all of this is just being really gradual and taking small steps and kind of going piece by piece and going slowly so that they meet success. And we don't create a situation where now we're exposing them to something that's going to give them this huge reaction and they're going to get really upset and really anxious. That's the last thing we want. So I think that's kind of the overall theme of, how you work on some of these skills with individuals with Asperger's.
What I also learned was that many doctors will prescribe psychiatric medication to treat the anxiety. And while I do feel that as a last resort, those medications could have their place, I think that people often miss that the child actually needs to be taught those emotional coping skills, that we need to identify those developmental skills that they're actually missing, that's causing the anxiety in the first place. And having just a pill to swallow is not going to always sufficiently address that problem. So what I've learned along my journey with my children on the spectrum is that actually teaching them those emotional coping skills, identifying the developmental skills that they're missing, and teaching them those skills actually results in the anxiety decreasing and improving so much. Tara, it's been wonderful to speak to you today. Thank you so much.
Thank you so much, Alana. It's been great.